So what we're going to use for clinical photography, we're going to use a DSLR body. It really doesn't matter which body you use. In this case, is a Canon Rebel. There are many generations now. The key point is actually the macro lens. This is the macro lens. That's really important. 100 millimeters Canon macro lens EF. This is really important. And of course, the second most important, so the body is not important at all. You can use Canon, you can use Nikon, doesn't matter what you use. It's really important to have a great lens and a macro ring flash. Ring flash is really important. I normally put it always on auto, and then you want the battery to charge really fast. So if this doesn't become red really fast, it means that you have to change the batteries. So always have extra batteries ready to go, rechargeable batteries. And and then of course you see the equipment here. We have the lip retractors. These are called auto retracting lip retractors because you don't need an operator to hold it. It's going to be retracting by itself. There are different sizes. The other key thing is our LED device that has 3 LED lights, and if I put my hand here, I feel that there is air pushing out. So if I use one of my fancy mirrors, I won't have any fogging, and I certainly don't need external light. So that's extremely convenient. These mirrors can be sterilized in an autoclave. They can also be we can also use surface disinfectant to use them. So you really want to have the batteries charged in advance. So you have one set of battery which is here. You want this battery to be always charged and have a backup battery. Then this is the first battery that has to always be charged. This battery lasts a very long time. The second battery that doesn't like second set of batteries that don't last a long time are these batteries. So these you have to have 2 or 3 sets times 4 batteries always charged and ready to go. And then of course, last but not least, you want the battery in the blower to be charged. It's an internal battery. That's why you need to charge it and have a backup. So we always have a backup of everything ready to go. So with this very large mirror over here, we take occlusal views, lingual and occlusal view, upper jaw and lower jaw. With these mirrors, we do lateral views mostly. So we're gonna use them right away to see when we use the occlusal mirror and when we use the lateral view mirror. Okay? Because the camera is heavy and also because the camera is pretty expensive, we want to have the band always on the neck. The first picture I'm gonna take, I'm gonna put the lens on auto AF. And here it doesn't matter if you put 0.31 or 0.48, you keep it at 0.31. The important thing is to auto, flash on. And as you see here, I blocked everything so the assistants cannot change the settings. The settings I put in auto is green. Now you can play with the depth of view and things like that, but for this basic training on clinical photography, I make it really easy. So the first thing you want to do is to identify the patient. This is extremely important to take a picture of a document with the name of the patient. You can also take a post-it or a piece of paper, write first name, last name, and the date of service. Like today, we are May, whatever we are, you put the date. So there are 3 items you want to see. First name, last name, the date of the photography. That's the 3 items you need. Now, if you're using a computer system, you can even better go to the patient overview, take a picture of the screen. Or if you're in a nursing home, assisted living, you have something called a face sheet. You can take a picture of the face sheet. You put the face sheet on a table. Because it's auto, you just go up and down. Now, this is a DSLR. So basically, you don't want to use the screen over here. You want to use the viewfinder. So this is, you'll be looking inside the viewfinder. You'll not be looking inside that screen. You don't get the same result. So let's start on auto, flash on, and we take the first picture. Okay, so the very first picture, you want to make sure that you're stable. So typically your hands, your arms are close to your body, so you don't take a picture like that. You take the picture like this. the body language is different. Not like this, like that. You can put one leg in the front, one leg in the back, and my two hands are here. I'm looking at the viewfinder, and I take a picture with the patient not smiling. Okay? And then we go to manual. Manual. Instead of auto, now we turn to manual because we want to zoom in. Now I want to zoom in. There are two views. Lie down and say E. And then we have the patient bowing down. Now, very gently open your mouth. Perfect. So, in case you're not sure about the pictures, you do more pictures and less pictures. Now, come over here. So we can choose one of these retractors. The one that our person would like to use are this style, one of these three. Some doctors like to use this one. We're gonna see the difference. So, come from here. It's very, very difficult if it's your first time to use the retractor, the way you do it. If you are by yourself, you go first like this. Okay, you push it out, then you move this a little bit, bite down. This needs some practicing to do it the way I did, okay? Turn to my side. So now you have a good view. Now I'm still, I'm staying at the manual focus. My zoom is right in the middle of the two central incisors. Now open up just a little bit. Thank you. Put your tongue back. So I took two pictures. One focusing on the upper teeth, one focusing on the lower teeth. Here is the second type of retractor. This was the first type. This is the second type of retractor. As you see, you have maybe a better view, but it's a lot more difficult to put. Let me remove it. Okay. Now let's go back to this retractor. Put your head back. Sometimes you see, like with this patient, the lips are dry. It doesn't hurt to have the patient to put some saliva on their lower lips, or you put some Vaseline. Here we go. Put the lip retractor once more. This part you have to really practice. Now we are going to use the occlusal view. So the occlusal view, okay, we don't need external light. We're just gonna hold it. You can zoom in, yes please. Ask the patient to hold the mirror. Okay, then I'm gonna take the picture now. Now you can come from here and look at the doctor. One of the things I personally like to do is to use the disposable mirror. Patients have two hands. We will use both hands. So here we do the same exact picture in the lower jaw. No external light, open up please. And we ask the patient to very gently hold the mirror. So now we have the mouth mirror and the picture, and then we ask the patient to put his tongue behind the mirror if he can. He's doing a good job. This is a very easy patient. Thank you. We're done with the occlusal views. And we're going to replace another mirror. Now, this smaller mirror can also be used for occlusal views. Open up, please. Hold on, hold this, please. Thank you. And then it doesn't hurt to take some extra pictures here. From the other side. So now we can go all the way to the last tooth. In this case, patient has a second molar. And then the same thing in the lower jaw. And the other side. We're going to help the patient to hold it in the right position. And sometimes we can hold the patient to look at the lower anterior. Could you please hold this mirror with one hand? Perfect. And we take a nice picture from these teeth. Good. Now we can use the lateral view. Now bite down, please. So while patient is biting down, we take a lateral view. Could you hold the mirror with your left hand? Thank you. Bite down. So the first picture, we focus on the canine. And then we're gonna go and focus on the back teeth. Open up just a little bit, thank you. Okay, now lower jaw, turn to my side. With your right hand, please, now. Bite down, please. Bite down, perfect, thank you. Open up just a little bit, thank you. Thank you. Here we go. Thank you so much. That concluded our clinical photography. Now we sterilize what needs to be sterilized, autoclave, cold sterile, or surface disinfectant. And the pictures are now in the SD drive. Want to make sure that it's saved and it's put on a hard drive. Every picture is saved under first last name, uppercase. Every letter of the last name is on uppercase, and the first name you start with the first letter uppercase, the rest lowercase, and then you put a date. Today, for example, we are May 23rd, 2019. You can put May 23rd, 2019 to prevent errors of, instead of putting 05/23/19, it's better to put May 23, 2019, 2019. Here we go. Done.